We now wrap up our look at Reach Niagara with a look at what's next for the organization and some thoughts from those that are bringing healthcare to our most vulnerable residents.
So we have a few plans for this year where we are looking at expanding our mobile health clinic to include other point of care locations and new communities. So we're currently in discussions with community partners, with Niagara Region's homelessness services to really give thought of, okay, where do we need to be this year? And so we do have a number of new clinics that we are planning, and honestly, we're very excited for, because again, that means more service for more people.
Those plans for 2024 and beyond are impacted by the surprising fact that despite the need for the services they provide, Reach Niagara are still without permanent funding.
Honestly, it breaks my heart that we don't have that base funding. And I'm hopeful, right, that like the work we're doing now and the way we're connecting with people now will kind of change that over time, right? And really pushing and connecting with community partners and really trying to expand. I'm hoping that those relationships will, eventually lead to us having that base funding. But yeah, it's just like hard to imagine that we don't have that even.
That is something I will say keeps us up at night. Because again, we view our services as they're critical to the community. There's no doubt about it. No one else is doing this volume and type of work. And for us, we are actively having conversations with various potential funders and really demonstrating the need for this unique model of care. There is a place for all other primary care because people need primary care. But when you're talking about care for your most vulnerable community members and shelter health care, that is something completely different and relatively new. And so we're having those conversations actively with funders. And now that we have some really robust evidence to show, hey, there is a need and look what we've been able to accomplish.
While the search for funding continues, the team at Reach Niagara will continue to bring care to where it's needed most.
So those living in poverty, those who are homeless, we know they have worse overall health outcomes than the rest of the population. They have a significantly lowered life expectancy, higher rates of chronic pain, mental health, addictions, diabetes, chronic disease. And these are the people that our system tends to fail in terms of being able to provide access to health care. So you need to just keep pushing forward to help support these folks because we're really only as good as our most vulnerable population.
I've always been a huge advocate for Reach Niagara. I think what they're doing with the marginalized population and transient population is so phenomenal because we really do need this in Niagara. There is such a huge number of orphaned patients that don't have primary health care that really need it. And they're going to the patient where they're at to make sure that these patients get care, whatever care that is, whether it's mental health counseling, whether it's care navigation, whether it's primary care, cancer screening, all of that stuff. They're making sure that they're trying to make sure that no one falls between between the cracks, sorry. And that's one of the huge things that inspires me in my role is to make sure that we're filling those gaps. Those cracks aren't there, people aren't falling in between.
I think people generally need to know how vulnerable these people are, right? And how complex it is. Because I think sometimes that there's different community attitudes around homelessness and addiction and mental health, right? And I think it's so complex, right? And these people are so vulnerable, and it's not as easy as just getting a job, even as getting housing. And I just hope we're able to kind of change our community attitudes too, right? Just to kind of soften a bit and recognize like how complex it is, right? Just even that.
Thanks to Reach Niagara and their partners for sharing their stories with us over these past weeks. In Niagara, you're watching The Source on your TV.